everyone, Dr. Jeff here today. As the Olympics come to an end, it's been a great Olympics for Canada. I thought I'd talk a little bit today what happens to athletes that actually get injured at the Olympics. You know, someone like that American snowboarder that broke his neck. Where do they go for their care? Well, over the past 2 years, or 2 years ago, the Olympic Committee in Penang actually put a request out for practitioners to come and actually work at the Olympic Games. It's all a volunteer basis to come and work there. And they ended up with 2,300 people that come and actually volunteer their time. And over the past 2 years, these practitioners, whether they're orthopedic surgeons, medical doctors, physios, chiros, psychologists, nurse practitioners, whatever they are, have been going to get training in Penang to learn the new systems, where they're going to be, how things are going to work. So at the Olympic Games, this year they've got 8 stations at different venues. So whether it's a hockey rink or the downhill skiing or the bobsledding, wherever it is, there'll be a station there. It's almost like a first aid station where there will be different practitioners there to look at initial injuries, or if the athletes want to get a massage or get worked on before they have to actually compete. So this will happen at the first aid station. And if something is more required, what happens, they'll actually go to the main station, which is at the Olympic Village. Olympic Village will have a portable MRI, a CAT scan, x-rays and things like that. And when you get assessed there, if something else is needed, they actually have a hospital that's on call specifically for the Olympics. So the main hospital, if something more is required, these athletes will be sent there for either surgery or for more types of care. So that's what will happen when an athlete gets injured at the Olympic Games. Right. Back in 1996, Donovan Bailey, who was our Canadian gold medal winner and world record holder of the 100-meter sprint, actually had his own personal chiropractor, Dr. Mark Scarucci from Niagara Falls. He traveled with him all the time. This kind of got people interested in what chiropractic was all about. And over the years, chiropractic has really come to the forefront as far as athletes are concerned. So what do chiropractors do? Well, we deal with nerves, muscles, and bones. So the whole idea is to try and make the nerves, the muscles, the bones work better so you can be the best you can be. And in the 2010 Vancouver Olympics, Dr. Robert Armitage, who's a chiropractor in Vancouver, actually got named to be the head person of the main clinic at the Athletes Village. So he was responsible for the main one that had orthopods and massage therapists and physios. So that was a big coup for chiropractic as far as where we stand within the medical practitioner field. This year at the Penang Games, when they looked at the roster of the American practitioners that got sent over, 36% of the practitioners that got sent over were actually chiropractors as part of the medical team for the Americans. A lot of teams that Canada sends over, whether it's Hockey Canada or Bobsled Canada, they all have their own chiropractors on, as long as a physiotherapist probably, a medical doctor, or an orthopedic surgeon. So they have their own personal ones actually sent over as well. So the athletes over in Penang are getting great care, whether it's physio or chiro or orthopedic surgeon. They're all there helping them to make sure that they're the best they can be and make sure they're healthy for their event. So chiropractic has come a long way. 84% of our Canadian Olympic athletes are under regular chiropractic care. 90% have either seen a chiropractor or are under chiropractic care. So chiropractic is very big in the area of sport. Very good at keeping them the best they can be. If you want to be the best you can be, maybe you should try chiropractic. I'm Dr. Jeff. I've got your back.